Very good day and welcome to Resilient Lincolnshire Executive Education. This event is streaming live and simultaneously across Facebook, LinkedIn and on our YouTube channels. Do please keep your comments and questions coming through as we'll get an opportunity to pick up on some of these throughout the discussion. My name is Tarzem Shoker. I'm the Marketing Manager for the Lincoln International Business School. And today we are hosting the series called The Executive Education. Now, this forms part of the integral part of the Resilient Lincolnshire project, which was conceptualized in partnership with the Centre for Resilience. For those that have been following us will know that this series is about creating and continuing a dialogue and a connect between the university and our wider stakeholders who have been facing this current challenge we are in. Today, we have a very distinguished and international panel for you today, discussing the impact of COVID-19 on the economy, health, and climate. So without further ado, I shall bring on Shabani, Dr. Shabani Saha onto the fold, who is a senior lecturer at the University of Lincoln International Business School. So good morning, Shabani.
Thanks to Mr. Tarzem Shoker, our marketing director at LIBS, Lincoln International Business School, who is the person behind organizing this grand event this afternoon. Good afternoon and good evening to all my distinguished speakers and audience who join live with us now. On behalf of Lincoln Economics and Finance Research Group, Lincoln International Business School, University of Lincoln, myself, Shrabani, would like to welcome you all in this panel discussion focusing 60 minutes on COVID-19, managing triple crisis, economy, health, and climate impact. I'm extremely delighted to introduce our distinguished speakers this afternoon, Professor Mukaddam Hussain, the leading sociologist, currently the Pro-Vice Chancellor of Bangladesh Open University and the Founder Director of the Center for Disaster and Vulnerability Studies, and also a Professor of Institute Disaster Management and Vulnerability Studies, University of Dhaka, Bangladesh. Professor Gauranga Gopal Das is a distinguished professor of expertise in trade, technology, and growth at the Hanyang University, South Korea. Professor Mahbooba Nasrin, distinguished professor of sociology and the current director of Institute of Disaster Management and Vulnerability Studies, University of Dhaka, Bangladesh. Dr. Minhas Mahmood is a senior research fellow and development economist at the Bangladesh Institute of Development Studies and visiting scholar of KICA Research Institute, Japan. And Dr. Razvin Karim, expertise in trade and development, is a research fellow at the Bangladesh Institute of Development Studies. An interesting point to share here before I start, Professor Mukaddam and Professor Mahbooba are my proud alumni of Massey University, New Zealand, from where I did my doctoral studies, and Dr. Karim was my fellow colleague at the same time when I was doing my PhD studies. So today our discussion topic is 60 minutes on COVID-19, managing triple crisis, economy, health, and climate impact. So we all know that COVID-19 has created a great damage or impact, negative impact throughout the world and put all the countries, including developed and developing countries in the world, in the same platform. So I'll just go through very quickly in terms of some impact. So this slide, we can see that countries like developed countries like US and UK, the number of COVID cases if we look at number of COVID cases in the world, is it around 13 million, and death is more than 500,000. And countries like developed countries, US and UK. So US, you can see that the global COVID cases is more than 3 million, and death is more than 1 million. And in UK also, we have very high rate of death, like 44, more than 44,000. Countries like Asia, China, India, Bangladesh, South Korea, like, if we can say particularly South Korea is under more control in terms of cases and death, but India and Bangladesh is now going towards a peak, and their death rate and cases increasing. And we can see that similar scenario in Africa, Angola, and Algeria here, and especially Latin American countries, Brazil and Mexico, they are also going very high impact in terms of cases and death. And if we go through very quickly, what is the impact on economic growth? Because that is related, because of lockdown. Now everything is stuck, and there is a huge damage to the economy. And in terms of economic growth, we can see that overall developed country growth rate is reduced from 1.7% to minus. Please, Taj, please go to that first slide. Yeah. So we can see that developed country growth rate reduces 1.7% to minus 6.8%, and developing countries is 3.7 to minus 4%. So mostly we can see that all countries, whether it is developed or developing, in terms of economic impact, they are really going through a serious crisis. And in terms of, especially, we can talk about why it is that countries are related globally with export and import. Those countries who are highly reliant on export and import, in this chart we can see that South Korea is, compared to other countries here, their export and import category is very high. Even we can see country, no, even it not in here, we know that Hong Kong, Singapore, their export import is more than 100%. And in terms of unemployment, we see that very high unemployment, like India is predicting 27.1%. US is also very high, developed country 37.7%. And next slide, Raj, please. So this is a very quick scenario about US. We see that the biggest economy in the world. So because of this crisis, especially April and May, their unemployment rate go 14% or over 14%. And next slide, please. So this is a supply chain scenario where we can see that whole world is linked, and every country through export import, because most of the production taking place in this East Asian country, China, Japan, Korea, and through supply chain, whole world is stuck. And the final one, touch please. So this is another crisis we are talking about, especially South Asian countries, India, Bangladesh. They have seen last month a severe storm that destroy severe damage in both countries, along with COVID-19. So we are focusing, thank you, Taj. So we are focusing three crises here, and we all agree that these three crises, they are not independent, they are interlinked. So we will discuss today how they are interlinked and what their impact. So firstly, we are focusing on economy, and as we discuss, economy wise, it is a severe damage to growth. But if we look at the impact in terms of globalization, export import industry, supply chain, how they will suffer most, even they are, because of lockdown, even they are not affected seriously with that COVID crisis. So how countries can manage their trade through globalization. So we'll discuss with that evidence what happened to Bangladesh textile industry, should we see some supply chains? They should shift their existing location to a new one, say for example China to Thailand, Bangladesh to Vietnam. Whether these crises have availability of relevant technical skill essential to attract them. So this question is to Professor Gourango Das and Dr. Azrin Karim. So Gourango Das will discuss more about the theoretical part of it, and Dr. Azrin Karim will go through more evidence wise. Thank you, Professor Gourango Das. Is he not here? Then I will request Dr. Azrin Karim, if you can go ahead, please.
Shall I start or?
Yeah, I think please you go ahead because I think he has some connection problem. Oh
he's
yes,
back,
he is
right?
here.
Sure.
Yeah, Professor, you have muted. Please unmute. Yeah.
Okay.
So first question is to
So should
you.
I go ahead?
Yes, yes.
Okay. So thank you for having me on this webinar. It's a great privilege. Thank you everybody and all the distinguished speakers. So regarding the impact of COVID-19 on globalization, I think we need to take a more holistic view because globalization has many facets. It just not only
I think he has having some connection problem.
I got disconnected again. Can you hear?
Yes.
Okay.
So please start.
So I think I'm getting disconnected quite often. So I hope it works now. One of which is trade, which is related to supply chain. Not only are also affected. So I would touch upon different way. So I will distinguish between two different periods.
I think Azrin, you can start now.
Hello.
Yeah.
Okay. So can you hear?
Yes, yes.
Okay, so before the COVID crisis and just after the global financial crisis, also we had a triple crisis. But that time the crisis was related to environment, financial crisis, and the fuel crisis. And one of which is trade, which is related to supply chain. One is the food crisis, and second is the multiple or dual burden of COVID crisis. Now, what happens in this COVID crisis is that we have a supply side shock and a demand side shock because there is fall in demand, consumption demand because of the closure of workplace due to lockdown, and also there is supply side shock because of this disruption of supply chain. Now what happens is that there are two sorts of shocks into the system which impinges on the global supply chain. One is related to lack of demand because people don't have money because of lockdown, either phased lockdown or even if it is lockdown is eased, eased, but still people will suffer from full employment into the economy because they cannot participate fully. So there will be lack of demand always. Migrants, the movement of labor across border has fallen. So there is fall of remittances, which is a capital flow inside the country, say in case of low and medium income countries like Bangladesh, Nepal, and all other countries, which given the short time, I would cursorily mention that this is a globalization pause button somebody has pressed due to this COVID, but it's not a threat. It's a threat when the COVID will be tackled. Now, the problem is how to manage this globalization. The question boils down to the point that how to manage this globalization
I think there is a problem going on. So, Azim, if you can continue and if you have time, then we can come back to that this part. Yeah, please go ahead and please unmute.
First of all, thank you very much. Distinguished all the distinguished speakers, and good afternoon to all the viewers from around the world. And greetings from Bangladesh Institute of Development Studies. I'm Dr. Azreen Karim, currently working as a research fellow at BIDS, Dhaka. So the first question that was for today is basically that because we are actually still facing an unprecedented crisis due to a virus which we are not aware of, and we are not still not even understanding the ongoing impacts and the likely impacts that are going to come, and the globally we are going to face. Uh, can we say that because a big chunk of the world's population, almost like more than half the population of the world, more than 3.9 billion people are being affected, and more than 188 countries, can we actually say that globalization is under threat? Now, to answer to this question, let me just point out to some recent expert views. I just want to start from there a bit of. So we all know that because this is a scenario we are not prepared of, we are still trying to understand what's going to happen. It seems to be very much contagious. The whole world is kind of still in a hard situation. Some countries have kind of like managed to contain this virus, but still it seems that they might face a second wave. But what is the difference from the primary policy? Initially, there was a global halt. Almost like more than 188 countries have actually faced some form of quarantines, curfews, shutdowns, lockdowns, full lockdowns or partial lockdowns. But are we actually still onto that policy or not? That's a first thing to understand. Recently, when IMF was kind of delivering their global economic outlook for this year, 2020, the chief economist said that probably, despite the fact that we might have to face a second phase, but probably we might not go, countries might not go into full lockdown because we are actually in a dilemma. We have to save our livelihoods, especially in the poorer countries which lack a good amount of infrastructure. A lot of people kind of work in the informal sector, and we probably people are going to die more from their lack of earning. It's sort of like kind of lives versus lives in a sense. Uh, so to answer this question, that can we actually say that globalization under threat? My response will be sort of both. because of the fact that it actually depends how countries manage and contain this virus and manage the economy. I'm not in favor of probably what the famous Harvard economic professor Carmen Reinhardt recently said, that this pandemic is going to probably put the last nail on globalization. I'm not 100% onto that perspective. I think for the time being, countries definitely will be cautious in terms of opening up the economy, especially the borders. If you can see countries which have claimed that they have successfully managed and contained the viruses, for example, New Zealand, but still they are still considering how to open up their borders, because that is the probably the likely source this virus actually entered in each of these countries. But although countries will be very much cautious in terms of opening up their borders, I think there will be different type of strategies based on which they're going to play their game in the near future. Now, how to manage this potential problem? That's a very tricky question. But in this line of, to answer this question, I think it's better to look at from the perspective of what might be the likely change in this whole process. For example, rather than saying that the entire globalization will be under threat, I think when countries will be starting opening up their economy, probably countries will be going more a bit reverse from multilateralism to bilateralism. And in the short to medium term, in the long term, I don't think this might be too much a problem, because as long as we know that we might get a good solution, sustainable, efficient solution in terms of a vaccine. But a reverse from multilateralism to bilateralism in the medium term, I think
I think we can move. There is again, today we are having this connection problem. We can move to the second question, efficiency versus equality and equity. So we have seen that deprived are the most sufferer from COVID-19. So increase in poverty, unemployment, both in volume and level. So what would be the suggested policies to cope with increased poverty and inequality? So the question is to Professor Mukaddam and to Dr. Minas Ma'am.
Thank you very much, distinguished speakers, honorable moderator, distinguished audience and participants. Well, it's my privilege to speak on behalf of Lincoln University. And the question what you have put here actually, so my response would be like this. There are three situations actually. One is economic viewpoint, another is health viewpoint, another is COVID viewpoint. Now, climate viewpoint. Economic viewpoint, equity efficiency is related to maximizing the production efficiency of a market, but also part of unequal distribution of economic resources, and which may also advocate public policy to limit the productive efficiency. The aim of such advocacy is to generate a more equitable society. And in this particular circumstances, an equity efficiency trade-off is related to a market. So now in the context of Bangladesh and India, if we see the post-suffering situation out of the COVID-19, then we could see that in Bangladesh, out of total export volume, more than 84% come from ready-made garments industries and textiles. But due to COVID-19, especially in the second quarter of the year, starting from the March to June, then we could see the about 5.8% export has been declined and reduced. So this is the scenario actually within this particular RNG sector. Apart from that, in Bangladesh, we are having 12.2 million workers who are working in overseas. And these particular overseas workers, out of this 12.2 million, more than 70% they have returned to home actually. And you can easily understand those who returned home, they are unemployed and they are facing severe economic, social, cultural hardship along with their families. And the economy is also having tremendous negative impact because of this particular situation. And apart from that, about you could see that in Bangladesh, 33 million people are plunged to the poverty situation out of the COVID situation. We had less than 12% abject poverty line people. Now it has jumped more than 20% population are very much part of this kind of abject poverty situation. So this is the harsh reality. Now, if you look at the Indian situation, more than 100 million seasonal migrants workers became unemployed out of this particular COVID situation. And you know the sufferings, not only these particular workers, along with the family, community, locality, ethnic minority group of people, and also many subsects, caste, and other situation within this particular Indian society. And again, in Indian society, more than 17 million workers who work outside of the country, and most of the workers now are under compulsion coming back to home. And this is the another situation within this particular situation. In UK, you see the situation in the agricultural and industrial sector where the workers, they used to work, many migrant workers also used to work in this particular situation. Now, the economy has is shattered because of this particular productivity has been declined and also diminished. And also the workers, they are not in a position to continue their work. And although the US government has huge multi-billion dollars package, benefit package, still it does not help in economic productivity and also in the growth of economic in terms of GDP, GNP, and per capita income. Now, because of this particular situation, we are also having other problems related to COVID. For example, the broken public health infrastructure, both in India, Bangladesh, and in the Western world, no exception actually. And most of the labor force, they are too much vulnerable nowadays. In Bangladesh, for example, apart from those particular workers, as I mentioned, hundreds and thousands and millions of informal sector workers, they became unemployed. Those who are very much part of this particular capital city. And if you take the example of Mumbai slum, you see millions of people who are prone to this particular COVID situation and who are by no means able to maintain this kind of social distance, and they do not have this kind of sufficient food to maintain the balance and increase their body resistance so that the COVID cannot be part of this kind of infection. So this is the harsh reality actually, both in India and Bangladesh. And flow of goods and services that have been halted because of this kind of global pandemic situation. And as a consequence, you see the connectivity, globalization, and trade, commerce, business, and other mobility and movement that has totally been stopped. And as a consequence, most of the people globally, more than 100, 213 countries are very much part of this kind of COVID situation. So how we could be part of this kind of connectivity, that is the main concern. Another important thing is the normal social life. So this COVID situation has created a lot of negative impacts on the society as a whole. People, in many instances, are becoming part of this kind of stigma. They are suffering from stigma and this kind of restrictions, traumatization, stress, mental anxiety. These things are very much part of this kind of social, cultural, psychological, and mental vulnerability. And capitalism, although it has conducted positive impacts and implications globally, but it is again very much resisted because of this kind of pandemic, and the economy, society, and nature as a whole are very much devastated out of this particular COVID situation. Now, how can we get rid of this particular situation? There are many theories actually. Neoliberalism depicts an over-incited and seductive logic that where individuals are master of their own destiny, so they can manage their own. Everyone is self-made, and opportunities are also freely available. Merit is guarantees for success, hard work, etc. Has its positive impacts and implication. Nothing is related to wealth, class, race, caste, gender, or sexuality, and so on. But the reality is very different, you see. Within this particular logic of economy, societal rational aspects of human existence in the context of food, economy, housing, health, are very much part of this kind of sustainable livelihood. But the question is that whether we are very much part of this kind of sustainable livelihood at this particular critical juncture of this particular COVID-19 or not. What happened with millions of unpaid laborers, both physically and emotionally? First, their condition, their family condition, and the country situation actually. Then market forces are based on productivity. All the productivity has diminished in the diminishing pattern actually, and it's gone down. Irrespective of social class, caste, gender, ethnicity, race, and age and sexuality, almost all the segments of the people of irrespective developed country and developing country are prone to this kind of COVID-19. Now the question is how to get rid of this particular situation, whether technology at all able to help this particular situation or not. Well, that's the basic and fundamental question, and lot of debate with the application of technology. But apparently, this particular juncture of COVID situation, we could see we can identify the effective and proper technology to be part of promoting innovation in real time that might help us to get rid of this kind of situation. Digitalization and IT definitely would able to create more jobs globally, regionally, and locally, no exception. Let me give a single example in Bangladesh. In Bangladesh, we are never ever very much familiar with this kind of online shopping. Now you could see most of the people, hundreds and thousands of people are opting for this kind of online shopping. Everything, starting from the vegetable to any sort of devices, are very much part of this particular situation, no exception. Similarly, you could see the sector-specific, appropriate and need-based technology, for example, SME, small and medium scale enterprises, agroforestry, service sector can also be part of this kind of technological advancement. And environmental situation can also be managed in a very careful situation. And introduction of insurance situation and identify the proper technology in this particular India and Bangladesh context can help us to be part of this kind of global connectivity and other situations. Thank you so much.
Thank you very much. So let me comment on this question that has been raised. So the COVID-19, this is a global crisis already. We know that has affected. This is a crisis of health and economy. So people are becoming ill because of community transmission, and poor are most adversely affected. They are at more risk compared to rich, with lack of funding and care facility. So that has been observed in other discussions and writing also. The economic crisis stems from the fact that there has been lockdown to contain the virus transmission, social distancing, that resulted in many places production losses, employment losses, and income losses. So people have become largely unemployed, in developing countries like Bangladesh, lot of huge informal sector people have become jobless, businesses are closed. So the risk of unemployment has and poverty is huge in this. So the core challenges the countries are facing now is, while flattening the curve the virus spread, is to encourage people to maintain this uh, protocol, but that has effect on their livelihood. So, but it is important that the health issue need to be addressed. Without that, the economy cannot return to it in a sustainable mode. So the issues there, the countries are dealing with in fighting poverty or vulnerability, then in ensuring food security, people who has become poor, millions of people has become poor in countries in this part of the world, and in developed countries also there are people become workless, and so the restoring the economy, while also uh, the challenges that remains in restoring economy and bringing people's livelihood intact, while also containing the virus. So, what can be done to cope with this situation? Immediately, that we have observed and followed, that immediate response was to provide cash transfer, to provide food transfer to the people through the social safety net. So the situation of poverty and inequality that is in question today, in this question, can be reduced through social protection, enhancing social protection mechanism uh, uh, with improved uh, targeting of the beneficiaries who are at risk people. They should be bring under protection of income support uh, in the short, immediately in the shorter run, to provide them with employment opportunities. So the job creation is an important thing. The businesses has to be provided with support, so that people, when the economy is returning to the new normal, the support will be needed. Provide like micro loans, providing individuals and people through MFIs. That can be one option to increase people's income. Employment subsidy is something been considered in some places, that providing the employer to keep the employee some encouragement. Unemployment insurance it is an important thing that can, in the short term, support people in their situation. And also the issue of technology has been discussed, that of course the businesses has to transform to online and digitization, that has an implication on jobs initially, but that can eventually that can save more jobs. So for the sake of time, I will stop here. Thanks.
Thank you. Next question is more focusing on, we although know that COVID-19 is mainly the health issue, like we can see what is the provision of healthcare in terms of private and public. Like US, that is more focused on private healthcare, but UK, we know that public healthcare is very strong. But still, we can see that two countries face the similar problem and very heavy problem on that. And also, if we look at some developing countries where we know that private healthcare is, because of developing countries, even government healthcare is there, but it is not that efficient. So, in that respect, what is the thing we can learn now? Which way to go? So, the question is to Professor Mukaddam and Dr. Minaj Mahmood.
Thank you very much again. Well, if we just overview the health facilities and healthcare system in the West, especially in North America, Europe, UK, then you could see even during this particular COVID situation, they are facing acute shortage of doctor, nurses, hospital beds, safety equipment, ventilators, and are rendered too helpless in dealing with this particular rising number of COVID patients. But who are the prime victims within this particular developed country even? It is the ethnic minorities who are involved, especially those who are involved in frontline works and activities. They are the prime victims of this particular COVID situation, and also the oldest people actually. And you could see the most disadvantaged socioeconomic group, even in the Western world, USA, UK, and European countries. And also the different type of sex, gender, ethnicity, nationality, and migrants people, they are again the prime victims of this particular situation in Western world. But one advantage in the Western world is prevailing, that is the private sector healthcare system is very improved actually. In contrast, both in India and Bangladesh, you could see the private sector healthcare is not up to the mark and standard. And you will be honored to know that in this juncture of this particular COVID situation in Bangladesh, hardly few number of private hospitals are very much part of this kind of COVID treatment. More than 80% private hospitals and clinics are not included as part of this kind of COVID treatment and COVID patient management situation. So most of the public health situation is very much part of the government controlled and government sponsored medical college or medical universities, or the hospitals and Upazila Health Administration or District Health Administration on hospitals. This is the situation. Moreover, within this particular Bangladesh and India, the harsh reality is that we are having very few patients and nurses, hospitals, and infrastructure services, especially service providers, lack of service providers, and lack of professional public health expert. Another problem in Bangladesh is that public health professionals, they are not getting involved in this particular COVID crisis. Most of the physicians, they are getting involved. Most of the health administrators, they are getting involved. But public health is major area that need to be concerned and need to be coordinated with this particular situation. But they are very much excluded, unfortunately. And they are not well equipped even. Another important thing is that missing agenda is the research. So medical research is a mystery in Bangladesh. Although India is better, relatively.
I think again we are having some connection problem. I can request Dr. Mahmood to please go ahead.
Thank you. So this COVID-19 pandemic has exposed many limitations of health care provision sector in countries in both parts of the world, developed and developing countries. And we have seen that countries initially, the hospital system has struggled with receiving patients and increasing demand for care, increasing demand for critical care, even under the National Health Service in the publicly provided healthcare system, like in UK, and decentralized healthcare system in Italy. So in country like Bangladesh, of course, the problem was much more acute, that the health system was not at all prepared to handle this kind of crisis. So, and of course, there has been we have observed in developed countries, like also in other countries, in the immediate response that many transformative ideas, including telehealth kind of things, has been implemented to provide services. The staffing has been changed. The working hour has been changed. So there has been a new way of working in order to face the current crisis. So that is an experience, that what actually did work and what did not work, what challenges the frontline health worker faced in providing care is important to note and take lesson from. So, because the it's not returning the new way of work, because this is not going away very soon without the development of a very good vaccine or medicine for this. So the chances of the virus coming back is there. So the important thing is to build on the experiences that have been faced by healthcare provision. Uh, these things need to be taken into account to deliver uh, efficient healthcare services of increased demand. So the important issue for this is the maintaining high level of critical care capacity is essential, that we have seen has been suffered in private care also. The provision of critical care facility was not adequate. But in that preparation, it is important a supportive structure, like you need workforce, doctor, nurses, and we have seen in the UK, people are brought from retirement, or from people came back to do voluntary work to provide healthcare. So the supporting structure is very important, and patient transfer network, that patient communication between the healthcare providers or hospitals, linked with the community services, access to volunteer services that are important, has been observed, and that has to be geared. And of course, the governance structure is important, that can make quick decisions and efficient decisions to address the crisis. What we have seen, because in a country in a country context like us in Bangladesh, that or in other countries it might be relevant, because you cannot change things right away overnight. Like the inadequacy system remains within this healthcare provision. Of course, there should be more allocation to build up hospitals, to build up to employ more doctors. That can take time. But in facing this kind of pandemic crisis, there should be some kind of centralized system, like National Health Authority, under which direction and coordination things will be operated. Uh, so that for example, there are shortage of ICUs that can be built up quickly out of this within this centralized system. So what I want to close by saying that the important issue is that the system has been exposed the limitation. That limitations has to be addressed in the medium and long term. But while facing also another crisis that we have seen, that people are not receiving non-COVID treatment. People are not going to hospital, not receiving treatments. They are in the waiting. So how at the same time providing the need healthcare to the virus affected people, and also non-affected people who are otherwise ill. That is very important to balance these things. That is important in providing efficient services.
Thank you. So next question we can ask to Professor Gopal Das, that we have seen South Korea has managed to lot to COVID cases and crises using technology. If you can please share some thought and evidence what happened, please.
Oh, thank you again. I mean, it's unfortunate I got disconnected with the first question. I don't know whether I could make it. Yeah, that time technology betrayed. Now the technology, I have to tell out the technology story again. So I should start with, the a quote by Benjamin Franklin. who said that by failing to prepare, you prepare to fail. So actually, South Korea showed readiness and preparedness by preparing well in advance. So they had a kind of prior experience of controlling SARS virus and MERS virus, Middle Eastern Respiratory Syndrome, that virus, which gave them a lot of leverage in preparing for this COVID attack. But also at the same time, they were already prepared because of their good health and health infrastructure and public health system. Apart from that, due to this social distancing and physical distancing, the physical space and geographic proximity has to be substituted, right? So therefore they took good advantage of that to replace that by virtual space of flows. So, and they made good use of artificial intelligence and digitization. So let's going a bit back. So let me get this data. So they had their first case in January 2020. Within a month, the country had tested nearly 8,000 people, which is enormous, who were suspected of infection, but still mortality rate was quite low. And the mortality rate was 0.6% as compared to global average of 3.4%. This is the WHO data. So that means it's about, so the global average was 3.5%, whereas South Korea is 0.6%. So it was almost 5 times globally. But South Korea still at the initial stage managed to do it very well. And then by February, the test number was 82,000, which is remarkable. So how did they did that? So several things. One was quick mass testing, and enough infrastructure was there. They laid the foundation of that prior to this COVID attack. Then they initiated the world's first drive-through testing method. They were the first in the world to pioneer that drive-through testing, which motivated all the individual citizens to go and get tested. And if it's positive, they made it free, so they didn't have to worry about the cost of this test. So they can do it if they tested positive. Otherwise they have to pay a very nominal amount. Not only that, to encourage these people, they have a good social safety network by motivating for their on mental benefits. So it's like kind of mobile library service. So those who are sick or kind of having psychological trauma because of this unprecedented crisis, they could borrow book from the mobile library, which is unthinkable, which at first I saw here. I mean, this during the COVID, it was not there before. Not only that, they have these SMEs, small and medium enterprise, which they which they gave a lot of support for business delivery, and also digital contact tracing, because that was the cornerstone of East Asian success story, especially Korea and also Taiwan. I must mention Taiwan because Taiwan is also an outlier in case of success, just like South Korea. So they have systematic digital contact tracing and swift quarantines. Not only that, apart from all these things, which was aided by artificial intelligence and digitization, also the civic sense, the cooperation between government and the civic society and the people. So that means the voluntary social distancing people followed, which we lack, I think, in case of India, like this institution and the state and the central government and also the local authorities, so some kind of communication. So India has a huge IT sector and ICT sector, and we just take pride in that we have a lot of technological boom and service sector booming. But here in Korea, they made a very good use for humanitarian purpose because it's a social and humanitarian crisis, and they took good advantage to get contact between the government and the civic society and the state and the council level, just like we think about the panchayat and all these thing in case of India and Bangladesh probably. So the accurate and timely sharing of data was very important. And not only that, they were miraculous in developing all this data and use of this machine learning and big data thing to make use of the data, because data then became the new asset, kind of the important thing. So the key steps to protect healthcare, one of the most important thing was Korean triage system. It's called KTAS, Korean Triage and Acuity Scale, where if the patients are diagnosed but they are not serious, they had been isolated, they can independently do their own management with the help of some nurse, and that has several stages. And triage is a unique system which determines the acuteness of the symptom and of the patient, and accordingly they administer the treatment. If they are serious, then they go back to the hospital. So all these things work quite fine with effective and efficient monitoring. And not only that, one important thing which is quite novel in case of Korea was because of digitalization of service is the new terms. I don't know whether you have heard about it, and it came into also the Bloomberg News and all other international news. It's called untact or ontact. So that's a portmanteau in English vernacular, untact. So it's a new kind of vocabulary which emerged in the economy, and ontact means online contacts. So that became kind of viral, that everybody went untact. That means undoing the contact through use of digitalization, fintech, e-commerce, and remote work platforms, and also the gig economy, which boomed a lot. So that became a key growth sector, and that is the thing that I'm sharing that because India and other countries who can take lessons that we can generate job, because we are talking about jobless growth. So if we can invent some new sectors, because we are talking about triple crisis. So if we make investment R&D in clean technology, which is kind of green technology through green fund or whatever, and also into this kind of sectors, then we can have employment generation and we can boost up demand. And by that, we can again go back to the first question, which I couldn't answer properly because of network failure. The supply chain could be brought back. And in that connection, I must mention that there will be multipolar globalization where it would be led by East Asia, because the success stories, who are the signing stories in this case, they will take the lead, like South Korea, Taiwan, or Vietnam. And instead of this, unipolar globalization, now you will see the emergence of new global order with multipolar globalization led by East Asia. And open regionalism will take place with a lot of mega deals like RCEP, Regional Comprehensive Economic Partnership Agreement, or CPTPP, Comprehensive and Progressive Trans-Pacific Partnership Agreement, where South Korea with India and others can join and share their technology. So that's kind of technology transfer argument can creep in there. And also they have a lot of chat room, and a lot of even the high school and the university entrance, the computer science graduates, they build up their apps, and which became very popular for tracing where people are going and having this kind of COVID attack as a first time or second time. So basically support for greater use of artificial intelligence, development of 5G networks, and also giving access to the people. Is a human development and human capital concept and absorption of technology, which we in South Asia lack a lot because of institution and government and governance problem. And development of platforms for remote service, and installing internet of things sensors on roads for collecting traffic data. And one thing I must mention, because I was talking to Dr. Shah before that, because sometimes people wonder it's a kind of encroachment on privacy, because we are taking the data for contact tracing and digital. But actually people here agree, because it's for their whole well-being, the societal welfare. And the government make good use of this data, because when you pass through some zone and you are make aware of this situation, that okay, you have passing through this zone where you have so many COVID patients. Even at sitting at home, I get every day so many message by the city council that we have so many COVID patients in nearby your locality or not, you should not go. So that's a remarkable thing for use of just not talking about digitalization, IT sector, service booming, and income inequality, but making use of it reduces this gap a lot. So the Korean New Deal was a really New Deal, which we know about New Deal about Keynesian macroeconomic policy. But the Korean New Deal was just investment on Smart Korea Fund for, not building road infrastructure, which was the original New Deal during Roosevelt's time, Keynesian policy. But it's about investing in smart infrastructure, and therefore, initiating growth and inducing growth and human capital, education, and technology. Already the literacy rate is very high, and also private sector participated quite well. They bolstered via government initiative to nurture manufacturing of semiconductors, which is needed for digitization as an inputs, and biotech and health industries, as well as future in auto industries. So therefore here government took a lot of, like a role of a gardener, watering every plants like the gardener does. So which is a very good move. And also they were concerned about the environmental, the green drive as well, although there are limitations because economies are faltering. The growth rate, as IMF projected, will be shrinking. Like in case of India, it will be 3.2% negative. In case of Korea, I think the forecast is about 2%, 0.2%, something like that, I forgot. But above all, given all these facts, they were quite optimistic and quite diligent in investing uh, in those technology for betterment of the mankind and the human development. And high tech firms parts and equipment were also given incentive, and they were, in coming back to the first question, which I couldn't answer again, they were doing reverse outsourcing or kind of reshoring back those countries to make them attracted for foreign investment back to the country, because now the global supply chain will have a new face, I guess, in the coming, unless the COVID-19 is controlled. So now the policy is about controlling through medical policy. So therefore, technology is very important for attracting foreign investor for reverse outsourcing, reshoring back to our own country, because supply chain will definitely have a different reorientation, and a new global order will emerge with the different role of WTO and WHO as well. Thank you.
Okay, thank you. Now we are looking at the climate and COVID-19 and its impact. We know that there are a lot of issues going on, climate change and social development goal. And definitely there is also talking about in terms of gender, like who are more affected. So I would request the Mabuba Nasrin to take the You please unmute.
Thank you. It was a good learning, and I have been listening like a participant. So, and because there are a lot of issues that have already been covered, I am just starting from Professor Gourango Das's voice on how technology helped Korea to manage COVID-19, and how they have identified from the very beginning and started to take preparedness. In context of preparedness, if we look at that, COVID-19 is start urging for a paradigm shift, not for like a country or a specific country, but for many countries all over the world. So in that sense, it's a very new, like the wording, the phrase we are using, new normal for all. And in context of technology, in fact, since 2009, Bangladesh is hearing the Vision 2020 and also the Digital Bangladesh. So in that sense, if we can technological use, Bangladesh is very much developed or rich, I should say, in context of using mobile technology and some of the social media communication. But COVID-19 has showed us that we are gathering experiences to use technology, and you can find that in Korea the population per square kilometer is less than half of Bangladesh, like 529 or 550, but in Bangladesh more than 1200 per square kilometer, and it's a very small country. So, but still, technologically, if we use properly, Bangladeshi people getting messages. In fact, if you are talking about gender, we are talking about intersectionality. We are also focusing on the diversified economy or people and the stratified society. So, in that sense, we can say that technology is working to give messages, aware people, educate people, but it cannot control pandemic. In fact, it cannot prevent even. So if we focus on that way, that if we communicate proper message or actual warning or actual education through the technology, it is possible in Bangladesh. And in some context, we have seen that there are awareness related messages, some of the messages which are not useful, but government is taking that up. We are getting some information actually which is coming through the authorized organizations like Ministry of Health and also coming from World Health Organization. So that has been tackled properly. But in context of some information, like if we say that we have some uh, intelligence like indigenous based intelligence, which is also followed by some people. So that is also an area that we should give some take some advantages of those people who are using technologies and giving us information which will be useful very much. So in context of, I think you already asking me the second question to answer because time is very limited. That is about the gender perspective, and if we talk about sustainable development goal, that is leaving no one behind. So in that context, if we go back to the sustainable development goal, we have to achieve so many goals. Gender parity in primary and secondary education has been achieved by Bangladesh is in context of MDG, Millennium Development Goal. Then we have been looking at more inclusive and intersectional perspective, and Bangladesh was also doing well in that sense. But if you look at that, who are the most vulnerable, at the same time who are the resilient, from this pandemic we have learned new disaster preparedness. And if I give example of two, like one is going on, that is flood. If I go back to that question, like disaster and gender perspective, like the flood is very common disaster in Bangladesh, and cyclone is also a very common disaster. And we have faced in May 21st the cyclone Amphan, Bangladesh and Indian coastal regions, and as well as we are facing now northern and middle part of Bangladesh and some hilly region, eastern part, facing severe flooding. So in these two disasters, I should say that Bangladesh have experiences of dealing with this natural, or you can say that induced by extreme climatic events. So those two disasters, we have very grassroots level, like Professor Das just mentioned about the Panchayat Raj. We have World Disaster Management Committee. So we have many different tiers to deal with these disasters. That's why when we thought how government will handle or tackle these two disasters at a time, we find very well effort taken by the standing orders of disasters. Like the schools, those were closed, those have been used as cyclone shelter immediately, because people have to maintain the social distancing. But people are very reluctant to move to the cyclone shelters, but still 2.4 million or more than that, 2.4 million people have been taken to the cyclone shelters. And there were social safety net programs, social security services. Those were from civil society, national and international organizations have been doing well, we should say. But there are many problems like embankments washed away, the livelihood suffered and still suffering. But those women, those who were the resilient from the perspective, they are not doing that much because of having no place to work, because of maintaining social norms, because of not having any place to go. So there are many specific problems, but still these are the vulnerable group categories are listed. and government and other bodies are trying to support them, but still it should be continued. The flooding, which is not only Bangladesh, India, China, many parts of the Asia is suffering from that flooding, and we have the very good warning system. That's why, but still the surviving in this pandemic is becoming very difficult. Specifically, if we talk about the water, sanitation, hygiene, maintenance, that is for specifically for women, ministerial management and other issues becoming very crucial at this stage. Salinity, nutrition and water, not having safe water. So these are the problems that we are dealing with, and we have to have our satellite services used. We know that sirs just mentioned about the Mars H1N1, so many technologies that we have used, and we have to use technology because of this situation. We are having virtual meetings, so we have to be connected with the people who are at risk of facing most of the challenges. I think I should stop here.
Thank you. So our next question is to Professor Mukaddam Hussain. It is climate and health. We can see that when it is extreme vulnerability, mostly we see that the deprived people are more sufferers. And it is not only in developing countries, we can see that same scenario in developed country as well. So we like Professor Hussain to discuss and give light on that.
Thank you. Actually, in the context of Bangladesh, if we look at the policy of the existing government, then you see the disaster management policy of Bangladesh and even in India are very much biased towards natural disaster and grossly ignored to address the public health care of poor and vulnerable group. And again, the extreme climate variability is very much responsible for spreading all these particular pandemic diseases and epidemic diseases. Now, coming back to global scenario, before that, in Bangladesh and India, we quickly just have some points. For example, in national disaster management, Bangladesh is a role model. But what about this kind of pandemic and epidemic? We could see that we are having the tremendous lack of preparedness. Just let me give an example. When almost 6.6 million workers are coming back from abroad due to pandemic situation, so there was not a single arrangement of the screening of these particular workers, unfortunately, and everyone was allowing to go back to their home in the name of so-called home quarantine. But that created this kind of contamination in a very, very rapid way. And another situation is that this kind of disaster, especially this kind of pandemic and epidemic, we are not that much prepared actually. We have our lacking of capacity. We are having lack of this kind of research and educational services, and we are also having lacking in the context of social and behavioral awareness, and lack of secrecy and isolation, treatment and marginalization of vulnerable communities. That is another problem, and lack of promoting health through social action. This is also a missing agenda, and we also need to analyze this kind of underlying social, psychological, economic, political and cultural context of this kind of pandemic and epidemic. This is very important. In the context of Western world, we could see the situation is relatively better actually, because the public health care management system is very much people oriented, and they are having the better infrastructure, better technology, better research, and they are always supporting this kind of private sector, informal sector, and they are also involving the universities for conducting this kind of researches. And in our part, the lack of sectoral coordination and cooperation is another situation of the vulnerability. Now, I am coming quickly to this kind of pandemic, causes of pandemic due to extreme climate variability. Climate variability actually causes force situation, because of force situation, the extent, the severity, the magnitude, and the and this particular disruption of this particular public health. consequence is very severe actually, causing of death and injuries, unable to prevent the health catastrophe with the scarce resources, disruption of healthcare services, and disruption of preventive action, increase potential of communicable disease, and also acute environmental hazard, disaster and catastrophe, and causing generalized panic or trauma or stress or anxiety, and provocation of increased anxiety, stress, strain, depression, frustration, neurosis, and mental breakdown, and severe water contamination and disruption of sanitation system. In terms of this particular serious negative situation, Western world is having the better preparation, and they are having the better healthcare, better sanitation, and they understand about this kind of catastrophe, and they can forecast, they can do research, they can also introduce this kind of preventive measures and other situations. So in general, what I could see, this particular pandemic and epidemic are very much part of this kind of either man-made or of extreme climatic variability that are responsible for this particular situation, and we should have the short-term, long-term, and mid-term preparation, irrespective of developed and developing world. Thank you. Thank you very much.
Okay, our last question, like how we can take COVID recovery plan that can tackle climate change also. So I like to question this one to Dr. Azim Karim as well as Professor Mahbuba Nasrin. Okay, so very quickly.
Sure. Thank you, Shravani. So just to add what Professor Muqaddam Hussain and Professor Mahbub Nasrin has said, I just want to add a couple more points. Because we know that both climate change and COVID-19 is a global crisis, but we don't have to probably introduce climate change. We all know the introduction of this particular issue, which is quite unfolding and will be unfolding. The impacts will be unfolding in the years to come. But COVID-19 is in a situation of emergency, and it has created an unprecedented crisis, and we can expect unprecedented solution to this crisis. And we actually don't know how long we have to endure this. So for me, institutions could play a very good role, especially in terms of emergency response. We can bring in the legs of institutions in our disaster risk framework, which can perhaps work in a better way compared to what we are doing, the way we are doing stuff, even here in Bangladesh. The four legs of institutions I would perhaps refer. The first one is integration, which particularly means that we actually have to integrate both preparedness and response in such a manner that institution can work well. The second leg of institution is coordination. You will see that in Bangladesh, many efforts of the government seems to not work in the way they want it to be because of the coordination, some form of lack of coordination among the different government entities. So after integration, it's very much important that we ensure this coordination and how we can ensure this coordination. The third leg of institutions could be documentation. Like the way Professor Mahbub Nasrin has said, we have actually tackled multiple crises in this scenario as well. But the point is, probably we need some revise of these standing orders of disasters as well, to include the pandemic stuffs in a more clearer manner, so that in the future, in dealing with future crises, we can handle this scenario. The fourth leg, or the final leg of institutions for me, is action. How we can go with this. So what we are doing now is actually we are trying to put forth a semi-lockdown policy, but we still don't know how to actually handle this when it comes to particular institutions. For example, business entities, small businesses, educational institutions. There are different programs around the world which I suggest we can think of. For example, in the United States, where they actually have programs called Ready Business, Ready Kids, inside the Federal Emergency Management Authority. And there are some other programs also called I Prepare in the Asian Disaster Management Center. So these are the programs which normally the Emergency Management Department takes in the situation of emergencies. What I'm suggesting is actually to to design some intervention programs which will create awareness, which will create some infrastructure before we go on opening up the economy in full-fledged, and also opening up educational institutions. Uh, for example, we are facing problems that people are not wearing masks and not even washing their hands regularly, the way we are actually delivering the messages off and on. But we need to enact widespread intervention programs so that these particular behavioral changes gets into the nerves of the general population, so that they actually know what to do. For example, when a person gets out of a house, we actually ask them whether he or she actually took her mobile or his mobile or not. In the same manner, we should ask, we have to get that into our nerves, that have you actually taken your masks when you are going outside? So that's the point. These particular behavioral changes needs to get into our nerves. So to get things to this into our nerves, we need to act, we need to design intervention programs, we need to create awareness in such a manner so that we can actually implement and we can actually handle this crisis better way. The better we can handle this crisis, the more prepared we'll be. We can actually deal with this crisis in a much more efficient and sustainable manner. And we have to remember also, because we are already seeing that because we were not prepared for this unprecedented scenario, we are actually we cannot think of what to do in many aspects. So if for climate change the situation, the thing is again the same thing. We have to think, we have to get prepared. If you are not prepared in the manner that it should be, we might have to face the same scenario for climate change as well as of COVID-19. So with that, I'll probably stop here. Thank you very much.
Should I say something? Just adding to Azrin's point, that how people will internalize those norms and values, that how to be prepared with disaster management. In fact, for the first time in the academic primary and secondary curriculum, that has been included national disaster preparedness. So if you are from primary level, you are knowing that this is the preparedness for disaster that children is learning gradually. So now this is the time to revise all the national curriculum textbook boards for institutionalization, and that is SOD is under revision. It was revision, just the preliminary draft submitted. So at that time, now it would be revised based on the pandemic and tackling with pandemic. And we have the disaster management cycle. I think within South Asia, that cycle is very much prominent, that how to like pre, during and post disaster situations. So now we have to revise those in context of pandemic. We have Bangladesh climate change strategy and action plan, national conservation strategies. Those are all those documents, because document wise our South Asia very good documentation, and that institutional mechanisms have been developed from primary till tertiary levels. The disaster management managers are under training and they are having academic degrees. So now these all needs to be revised. That's very true. And the coordination is a problem for all over the world. And what we have learned from this pandemic, that is a good lesson. One positive side, if we say about this pandemic, that is that climate change. Like we can see more greens. We see that dolphins are coming, even the Ganges dolphins we haven't seen long time, but that is coming back. And when soon after the ships are in the stream, then we find that many animals are coming down, dying them. These are dying. So we have to revise all of our policies related to how we have been polluting our environments and how to deal with keeping this environment friendly environment for all the species, not only for the human beings. Then we will be in this chain, like that food chain we call. So that chain needs to be maintained, because we have learned how to save how to live in this environmental friendly and like institutions and housing, even roads and transportation. All of these have were giving some positive sides of this COVID-19. So that we have to be maintained, and I'm sure that it's need to be policy revisions. And if we look at these regulatory frameworks, international regulatory frameworks, international disaster risk reductions frameworks, international that climate change, that intergovernmental panels on climate change, how they will be. They have postponed this COP this time. So how the second, like when they will be starting, even they can start in this pandemic situation to gather the
I think some network problem again. We are very close to that end. Now we can take one or two questions from the audience. One question already here, Tapati Devi. What is the opinion about the future in the world economy in this critical structure of
So,
COVID-19?
are you moving or I should stop here? I'm just one sentence last that
Yes,
we
yes.
all are economists, and we have been giving theories on disaster preparedness and climate change to students, and we have been saying that Gary Baker given a theory that economically those who are solvent countries, they are more prepared to manage disaster. But for pandemic, we cannot see that. So there need to be new theories that how to like cope up or how to build resilient that in context of pandemic like phenomena. So it's not only economy that is making people more prepared for facing these challenges. It's other issues, social, economic, psychological, and of course the technological improvement, so that we can reach to our students, to so can reach, we continue our business. And if you look at the demographic dividend in Bangladesh, is like having more 27 plus people more than others. So there are a lot of rooms for improvement, and to give lessons to these people how to run or how to continue economy even there is a pandemic. So that's the major question. Like we cannot keep the economy going on like this. We have to face these challenges based on these economic opportunities, which should be technology based. Agriculture, from agriculture to other livelihoods, like women using technologies for environment friendly productions, how to continue those, how to link it with market, how to uh, how to deal with the challenges of the people with disabilities, those who have been doing something, just started to do something, but we have to continue these economic activities for them, even in this pandemic situation. We don't know when and how to stop this, but we have to continue our life. We have to move with our lives. Thank you.
Thank you. We can take a very quick question. It's Tapati Devi. It says that what is the opinion about future of the world economy in this current crisis? Definitely,
Can
we
I
can.
can I
Yes,
can I make 2 points?
yes.
Okay. Okay. I think despite the fact that the global supply chain is hardly affected, I think there will be a change in the demand side as well. I'm not sure whether people are going to buy a lot more cars or not. I think, but there will be definitely an increase in the demand for healthcare products. Then technology driven stuffs. That's one thing. And the second thing I definitely want to mention is we can actually expect a lot of geopolitical tension, especially after this vaccine comes out in front. And we might expect different various types of restrictions when people will start to open up and trade in goods and services are going to get initiated. So I think at that point, the World Trade Organization, along with the World Health Organization, definitely WTO has got to take some pragmatic steps so that geopolitical tensions can be in a very, very manageable, can actually countries can manage geopolitical tension in a much balanced manner. And of course, the restrictions different countries are likely to like impose in different sectors, especially in trade and in trade and services, that can be better managed, especially for the emerging and developing countries. That is something probably we can expect for the world economy. I mean, for the next scenario after this COVID-19 is going to get in a much manageable way. Yeah. Thank you.
Yeah, we can take one more question. So this is Debashish Mondali. Can military expenditure be reduced by the middle income nations to accumulate their health expenditure, particularly in public health sector? So definitely, I think we can say in this case, our main focus to overcome this crisis is health, and resources can move from one sector to other sector. So because it is more urgent need to recover the economy, so if there is not much threat for, because countries they spend money on the defense if there is lot of threat for war and other, but because at this stage there is not much change on that side, we can feel like government should spend more on the public health sector to recover the situation, to give lot of relief packages so that economy can survive. Is there any other comment on that?
Depends on setting priorities. Like,
Yes.
yeah, so the health sector need to be prioritized, of course, and there is trade-off in allocation. So, because the future there has to be reallocation, increasing allocation in the health sector. But whether that will come at the cost of reducing military expenditure or somewhere else, that is another question.
Okay, one question we can take from, just last one we can take. Yeah, it's from Martin Knight. Interesting discussion on a number of fronts. I'm particularly encouraged to hear the Bangladesh approach to this disaster preparation being brought into the school curriculum. However, what step in the Bangladesh government taking to support those refugees in the camp of Cox's?
Should I?
Yes.
Yeah. Thanks for the question. In fact, it's like in the refugee, this Cox's Bazar problem is Bangladesh is not taking them as refugee, referring them as forcefully migrated population or forcefully sent to Bangladesh, and all the humanitarian supports they require that are given to these refugee camps. But it's a camp, you know those there are many international organizations supporting government. We have a government organization working there. Specifically, many organizations started to provide educational support as well. So there are different networks working in those camps. But because the situation of Myanmar is completely different, culturally different, and this is Bangla is not their language, so there are difficulties at the beginning. But now the children's specific needs are addressed at a limited scale, because we still want that those people will go back, will return to their countries when the environment will be conducive for them. So all the humanitarian support, that should we say, that are being channelized to those camps. And as an international person, that how the world community is working in support of this forcefully migrant population in Bangladesh.
Thank you very much. So I think we share, and I like to thank all my distinguished speakers for your valuable time and the discussion we discussed a lot of aspect, and it is really an interesting discussion, and I hope that you all enjoyed this participation and the discussion. And thank you very much again. And I like to thank Taj also to organize and to coordinate this event. And thank you, everyone.
Thank you very much.
Thank you.
Thank
It's
you.
our pleasure.
Thank you very much.
Thank you.
Thanks
Thank
to
you.
you all.
We also extending our gratitude to Dr. Savon for organizing this particular show. Thank you.
Thank you very much.
Good evening.
Thank you, everybody.